recording. Look at the recording. So let's start. It is August 12th, Wednesday, MED210, 6NAX, 6 p.m. I'm Dr. Garais, your host. And what is due this evening? And of course, for the two people who were talking, who talked to me earlier about their working and if they could hand in their task 1, discussion 1, and lesson 1 this evening, yes, please do so. I probably won't be grading until like tomorrow morning, so that, but please don't make it a habit. Things are due today. Actually, in theory, things are due before the next class. So it's week 2. Last week we talked about skin. Hello, welcome, welcome. Last week we talked about skin and non-specific immunity. And non-specific immunity, sometimes they even just call it innate immunity. Those are the things that protect us, and it's non-thinking. So it's skin, it's mucosal lining, it is the ubiquitous inflammatory response. These things, they get activated just automatically, and there's no specific trigger. But this week, we're going to talk about specific immunity that has a trigger, that reacts to something. So what we're going to be talking about this week is, and of course, for your task 2, which is due next week, we're going to be talking about structures and functions of the immune system, different types of white blood cells. And remember, your white blood cells are your, what do you call that? Your specific cells that their function is to deal with anything that could be of potential harm to your body, whether it be foreign objects, foreign body, and that can also cause disease, and of course, any pathogen. And remember, the definition of a pathogen is essentially anything that can generate or create patho, which is disease. And of course, we're also going to be talking about the accessory organs that have to do with immunity. And the accessory organs here are listed, your tonsils, your spleen, and your lymph nodes. And of course, we have to talk about the source of your white blood cells, which is your bone marrow, which also kind of states the fact that bone isn't just like, you know, like a leg of a table. It's not just there for the structure. It's actually bone, and especially bone marrow, is actually a living, breathing thing that requires oxygen, that requires energy, and that can also be diseased. Bone cancers are relatively common. So let's look at, and these, especially this video is really nice, and we're going to go through bits and pieces of it. But let us, let's see, let us go into our OpenStax. And forgive me if take me a minute to remember overview, homeostasis, level of organization. We went all through this in Anatomy Physiology 1. Support, and you could see here, we're going to be talking a lot in like week 5 and week 6, a lot about the bones, as you see here. And so bones aren't only just to give you support and to help you walk and things of that matter. It's a little bit more complex than that. Nervous system, anatomy, nervous system, neurologic exam. Oh, I didn't know they had a neurologic exam. I should really look into that. Was it chapter 23? Oh, here it is. So your lymphatic and immune system. So let's look at that, because that's what we're going to be talking about today. The specific, when you think about your immune system, the specifics of it all. So of course, we already know that the function of your immune system is essentially to protect you against things that may get inside. And we already now talked about the non-specific barriers that's supposed to prevent from the pathogens from getting inside. But what happens if they do get inside? And they do get it, they do get inside. And again, it is also part and parcel of the mask debate. You see now there's a lot of people talking about the mask debate and what's the function of the mask. And I gave, I believe, I wasn't sure if it was this class, but I gave the example that we learned in Anatomy and Physiology 1 that viruses are very, very small. It will go right through that mask. It will go right through that skin. But what we also learned in Anatomy and Physiology is that, if your patient is vulnerable, meaning to say is if you're being attacked by other things and your immune system is being challenged by other things, that virus that wouldn't have hurt you last month, last year, last week will now hurt you. So, because you have to look at the larger picture on why we wear PPE and why medical professionals, why we wear masks in our professional environment, and why the CDC, World Health Organization, and the Department of Health are saying we got to wear the masks, right? We have to do the social distancing because remember, all the rules and regulations in a hospital aren't done for laughs. They're done for a specific reason, and they're also done because data shows that it is better to have the mask than not, okay? Especially in a closed, confined environment like a building, all right? Because you guys do know that when you're in a building, you're not really breathing outside air. You're breathing the air that the HVAC system is recycling, right? So knowing that, and knowing and understanding that having an intact immune system is one of the best things you could do against COVID, and understanding how the immune system works is vital to that as well. So let's look at the lymphatic system. Now, many times the lymphatic system, usually colored in green, as you can see here, a little big, right? We usually talk about the lymphatic system with respect to the cardiovascular system, because one of the functions of our lymphatic system is to provide extra fluid to our cardiovascular system. So when we're a little bit dehydrated or a little bit overly hydrated, the lymphatic tissues can either withdraw fluid out of our tissues and out of our arteries and veins into their system, so that system won't be overloaded. Or let's say if you're dehydrated, it can put some fluid back into that system. But I want to talk about your lymphatic system, right, as a means of defense for pathogens. And if you could see here, let's get even a little bit, maybe we'll get a little bit closer. If you could see here that the pathway, those are lymph vessels. But every once in a while, you'll see this bigger vessel or a bigger node, and those are your lymph nodes. Now, I want you to look at your lymph nodes as kind of like outposts, right? And because let's say, for example, I have a really bad sore throat, okay? Now, my bones are making the white blood cells. Because don't you think it's going to take a while for some of the white blood cells that's in my lymph fluid to reach up to my throat? So, but if I already have a lymph node right here that's ready to accept white blood cells and to deliver white blood cells to go deal with that infection, they're already there, they're closer. So I want you to see lymph nodes as these little outposts where the white blood cells can sequester and then go deal with whether infection or whatever problem that's going on. Your tonsils too. Your tonsils are also part of that same lymphatic and immunologic tissue. And whoever built us really smart. They put the tonsils here in your mouth, which is one of the dirtiest places in the world. Dirty as in it's bacteria laden. So it's very easy to get an oral infection. That's why dentistry is always saying that 15 minutes after you eat, you should be flossing and brushing in theory. Because there's a lot of things in between your teeth, in your gums, on your tongue, on your hard palate, on your lips. All of this stuff is, there's got a lot of bacteria, a lot of things in there. And here's a classic example. If you fell in a sewer, we just wash you off and we really wouldn't care less. Sewer is full of E. coli, which is floating cholamines, which is essentially what? Fecal matter. It's poop, right? But we don't do anything for you. But if you get into a fight, right, and you accidentally cut your hand on somebody's mouth, maybe you hit somebody in the face or somebody bit you, right? Guess what? I have to give you broad spectrum antibiotics. I have to do a wound culture, right, on the cut on your hand, and I have to give you a tetanus shot or tetanus booster if you haven't had one in the last couple of years, which outlines the importance of your tonsils and the importance of your lymph nodes. Now, lymph nodes are also very important because they are good diagnostic structures. Now, for the ladies in the lecture and even our male students, you should really be checking, doing your breast self-examination monthly, and doing it correctly. So look it up. Look up the Susan G. Komen Foundation for Breast Cancer Research, and there's a lovely video that they have on how to do a BSE correctly. And one of the things that we're looking for when we do a breast examination for suspected mass or suspected cancer, we look at these lymph nodes here in the axillary or the armpit area of my patient. Because even though I may not feel a mass here, if there's a foreign body like cancer, right, or something going on or some sort of infection, what will happen? These lymph nodes will get enlarged, sometimes even painful, and it will give an indication that in this area there's a problem. Same thing with UTI. If my patient has a suspected UTI, it's the reason why I'm feeling all around here. You know, when you guys get ticklish in the examination room, I'm not feeling you down here because I want to get into a lawsuit. I am palpating this area because if my patient has any urinary tract infection, there's going to be positive lymph nodes somewhere here around the femoral and inguinal area. So you could see now how the lymph vessels and the lymph nodes are very important diagnostically. Now, just in the battle for cancer or the battle against pathogens, what's good for the white blood cells to travel up and down, it's also good for cancers to travel up and down. We also look at the lymph nodes and also the lymph vessels as means of cancer to travel. A classic example is a Krukenberg tumor is cervical cancer that traveled up to your stomach. Now, you might be thinking, hey, wait a minute, that's weird. What does my cervix have anything to do? Well, your female patient cervix has anything to do with my stomach, but you could clearly see here, hey, there's a direct pathway. My stomach's around here. I could easily see how cancer, if it gets into here, can easily do what? Use our own our own pathways and our own immune system to travel around. And if my patient has cancer, there's going to be lymphadenopathies or little swellings here. So the next time when you have a little sore throat or maybe a toothache, I had a toothache a couple of weeks ago. So what happened, right? Little bit of infection, oral infection with the toothache. What happened to my cervical lymph node? It was swollen. It was a little bit painful to the touch. And that gave me an indication that, oh, there's some sort of inflammation or some sort of pathology going around in this area. So you could see how important understanding lymph nodes and what lymph vessels do, and also the importance of it when we're looking at it in a clinical manner. Here is how they interact with your blood vessels. Of course, this is an artery. It's colored red because it's oxygenated. This is a vein. It's colored blue because it is deoxygenated. Venule means it's very small. Arterial means it's very small. But what connects the arterial system with the venous system? You have capillaries. But what is also intertwined with the capillaries? Lymphatic vessels as well. So even though we discuss different systems separately, in real life, they're all connected. Okay? And there's just this major trunks of the system. And then we have also major like storage areas for lymph tissue and lymph fluid. And one of those places is your thoracic duct and your cisterna chyli, which is over here. And it makes sense because if you recall, we in Anatomy Physiology 1, when we dissected the pig, didn't it have a lot of arteries and veins here in the peritoneum? And remember what I said? All your intestines are full of E. coli. I don't want that floating around. But you know, if it does get out, who do I have in the area? I have a lot of lymph vessels that will help me take care of those potential infections. Okay, so the barrier defenses, or what they call the innate immune response, is what we were talking about last week. But this week, we're going to be talking about the adaptive immune response, and we're going to be talking about all of these guys, which are your lymphocytes. Lymphocyte is the medical term for a white blood cell. And you could see there are different white blood cells. And they all start with the stem cell, or what they call a pluripotent cell. And those cells are usually inside the red marrow of your bones. Now, that's why we're so interested in fetal tissue, because babies and newborns and prenatal babies, their stem cells are the precursor of everything who we are. So they're the beginnings of everything. And if we could figure out the genetics on how to make more of these and how to do these, we can be able to heal ourselves a little bit better. Now, how do you know the classifications? So there are granulocytes and agranulocytes. Now, this is a red blood cell, right? Which is in a white blood cell. This is red blood cell. And the function of the erythrocyte is to, what do you call it? Carry things, oxygen and carbon dioxide. And of course, platelets, we already know from last week, that is the clotting. Along with its clotting factors, this prevents us from bleeding to death. But here, let's look at these three first: basophils, neutrophils, and eosinophils. If you'll notice, they got this grainy, not so much you can really look at it here on the neutrophil, but just trust me that all three have like a grainy insides or cytoplasm. So those little granules, if you recall, remember we talked about in Anatomy and Physiology 1, we talked about all those little granules that were full of superoxides and things that break down things. And that's what basophils, neutrophils, and eosinophils do. They can wrap themselves around pathogens, wrap themselves around foreign bodies, and then they release these granules. So these granulocytes, and the way I remember it is, fill, right? What do you fill a pothole with? You fill a pothole with granules. Ever since EMS, that's how I remember it. But basophil, neutrophil, and eosinophil derive their name from the fact that the basophil loves basic stains, the neutrophil likes neutral pH stains, and the eosinophil loves acidic stains. That's where they get the name from. So you got basophils, neutrophils, and eosinophils. Those are your granulocytes. Now, what are your agranulocytes? Okay, those are your lymphocytes. Okay, now one example of a lymphocyte is your NK cell, or a natural killer cell. We're going to talk more about that gal in a moment. And also the other lymphocytes, which are your T lymphocytes and B lymphocytes. And your B lymphocytes, those are the things that produce antibodies. So NK cells and lymphocytes, on the two types of T lymphocytes and B lymphocytes. Those are agranulocytes. So these are your granulocytes, and these are your agranulocytes. And of course, monocyte doesn't have any granules either. They turn into macrophages. These are also part of the agranulocytes. Okay, so all the ones over here, agranulocytes, but these three, those are your granulocytes. And but the NK cell, even though it has little granules in it, it's considered part of this group over here. So all of these white blood cells, they all have specific functions, and they all deal with specific things, which we're about to talk about momentarily. And that is part of your CBC with diff. Now, your CBC is your complete blood count. Complete blood count will do all your total of all your white blood cells, total red blood cells, total platelets. But if you order a CBC, complete blood count, with diff or with differential, you'll get a percentage of how many basophils, neutrophils, monocytes, macrophages, so on and so forth. And from there, we can identify what's the word I'm looking for? We can identify like, is it an infection? Is it a parasitic infection? And I believe there's a chart in your when we go back to the Moodle, I'm going to show you where that chart is, and it's a chart that says if your neutrophils are increased, you have this. If your eosinophils are increased, you have that, and that's a nice chart to look at. Or I think there's one here too. Let me see if I look down. Maybe. All right, we'll look at it momentarily. So, what's B cells? What's T cells? And I already told you that B cells make turn themselves into a plasma cell, and they eventually make antibodies. So, what does B and what does T mean? B means bursa derivative or B cells, and T means thymus derivative, because your thymus is this vestigial organ in your neck, and it's only active when you're what's the best word? Not necessarily prenatal, but pre and perinatal. When your immune system is forming. Now, it goes? B cells produce antibodies, and what are antibodies? Antibodies is a specific group of proteins, and if you it goes, and if you know anything about antibodies, is they only attack specific things. And we're going to also be talking about humoral immunity versus cell-mediated immunity. And we're also going to be talking about how the T lymphocyte is related to HIV. So B cells, when they develop, make a plasma cell, and then they make antibodies. And T cells, you have T helper cells and T killer cells, and we're going to talk about their role momentarily. And of course, NK cells, natural killer, and they're also part of the agranulocyte family. Okay. So antibodies, and NK cell, very, very important in virology and against viruses. So it makes sense. If my patient has a ton of NK cells in my differential, then what am I thinking? I'm thinking my patient has a viral infection. It's not that simple, but in many ways it's that simple. Now, red bone marrow, thymus derivative, let's skip through that because we already talked about that. I want to get through like B and T cells. They go through that. All right, I'm going to get through that B and T cell stuff in a minute, but let's talk about the accessory organs since I'm in your textbook. Because once we finish up with the textbook part, we're going to go back to the Moodle. So your spleen. Your spleen is what they call an accessory organ or a secondary lymphoid organ. It's not the star of the show, but it is a backup. Now, The function of the spleen is to filter old red blood cells. Typically, red blood cells have about 120-day shelf life. So when they get around closer to like 115, 116 days or so, they get filtered. All the blood gets filtered through the spleen. The spleen will then start filtering out the red blood cells, and then it'll be a signal to your body to make more red blood cells. Another thing that your spleen does is, for emergency purposes, it holds anywhere from 100 to 150 cc's of extra blood, just in case, you know, something horrible happens, like you get shot or you get run over by a truck, so that you'll have like that extra blood, just enough for you to make it to the hospital, in theory. Now, nodules, we've kind of talked about that. Oh, let's talk about the MALT, mucosa-associated lymphoid tissue. Remember I just mentioned that your mucosal lining and your GI tract has tons of potential for E. coli messing up your day, right? Well, it makes sense that within, there will be lymphoid tissue within and around your GI system. And that is called your MALT, your M-A-L-T, okay? And your BALT, same thing, but now it's in your bronchus, which is your lungs. Because who else gets exposed to a lot of pathogens? And hence, back to the mask argument, right? I am wearing a mask, it goes scientifically, because there are a million two other things that will stress my BALT out. And if I do not wear a mask, it'll stress my BALT out, it'll stress my white blood cells, it'll stress my immune system, and then, you know, when your immune system gets stressed, it will drop a little bit, and just enough to let the door in for something like coronavirus. And again, another issue is also that if you recall Anatomy and Physiology 1, you're looking at the chain of infection. It's not a perfect thing, but you got to look at the parts of the chain where we can stop the virus from moving forward. And mask and BALT and MALT and your own immune system and understanding your immune system, and we already remember that from Anatomy and Physiology 1, your limbic system, or your mood and your overall overlook of life. And I know it's like a happy, shiny thing to say, you have to keep the positivity up in not only yourself, but your patient, because this bombardment of negative feelings and negative vibes is enough to increase your cortisol. Cortisol decreases your immune response. And then what happens? It opens the door to what? To infection. And that's how viruses, and that's how how COVID works, right? But you could see, but we're trying to figure out why COVID likes lung tissue. That's a little bit tricky. So what's this next button? Okay. So let's now go back to course, so we can get back to some of the things, and let's review. What do we? What did we already talk about thus far? We already talked about, right, the types of lymphocytes. Where do lymphocytes grow? Specifically, red bone marrow. We talked about lymph nodes, the spleen, a little bit of the tonsils, right? We talked about white blood cells and their function, and other organs of immunity. We already talked about the accessory organs. Let's look at white blood cells and their function. And I think it's in the lesson. If not, I'm going to Google it. And again, watch these videos and practice. I'll be the first one to admit, not every video is great. And sometimes it's corny, and it's, but this is part of the skill set. Can you take notes, and can you combine notes of the things that I'm saying, the things that the textbook's saying, and the things that you're learning all along these videos, and can you put it together in a cohesive manner. And of course, activity 2, don't do this. What's due, we're going to be talking about momentarily. Of course, the application is assignment. So let's go into this lymphatic system and immunity. And remember what I told you about these Carolina things? They have these wonderful notes. And they talk a little bit about what we were talking about. Let me see if I can get that. Galt, we already went that. B lymphocytes, T lymphocytes. Oh, here we go. Let's now talk about, again, let's go back to B lymphocytes and T lymphocytes. As stated earlier, the B lymphocytes are part of what they call humoral immunity. Humoral not meaning humor as in funny, haha. Humoral as in al, pertaining to the humors. In the turn of the century, humors was called the fluids. We used to believe that that if you had like bad blood or you had the bad humors, you'd be unhealthy. Hence, if maybe some of you remember the ice cream, good humor, right? What's ice cream? It's fluid, it's good, it's milk, it's good, but not really. But the humoral system has something to do with fluid, and of course, blood is fluid, hence the term humoral immunity. And humoral immunity deals with B cells, and we already now know about antibodies. Now, the T cell is cell-mediated immunity. You actually need both, okay? You both need the antibodies, which gets produced by the B cell, and also the T helper cells and the T killer cells, which are part of the cell-mediated immunity. You also need that as well. And of course, the derivative of T is the thymus, B is bursa, right? Which better, I just remember them a little bit better than T cells for some reason. Now, what's so great about T cells and B cells? Well, T cells and B cells respond to specific pathogens. So we already know that every cell has a coat, has a glycoprotein coat. You should recall that from your Anatomy and Physiology 1. That means they can be identified chemically. So if you can know something, right? So it's actually profiling cells as good or bad. Now, if you have an autoimmune disease, you don't know the good guys from the bad guys. So your body, your immune system, starts attacking yourself, right? Because it cannot recognize the glycoprotein coat. And if you don't have good memory B cells, that antibodies that remember the last time you got infected, what's going to happen? You're going to get infected all over again. Same thing with the T cells. If there's no T helper that recognizes, hey, I know that guy or that gal, that's a bad guy or gal, I need to kill that. And the T helper cell is called a antigen presenting cell, or APC. They're kind of like a tattletale. So in both these systems, it recognizes previous infections through their glycoprotein coat, and it's able to tell your body in a faster, quicker way, hey, go kill that thing, right? And things like macrophages, which is a very large immune cell, NK cells, which are a very large immune cell, and your T killer cell that I mentioned before, that's part of your T cells, they're thugs. They're not that smart. But if you have an antigen presenting cell, like a T helper saying, hey, get that guy in the corner, then they'll all surround that pathogen and then kill it. How about memory B cells or antibodies? Antibodies are highly specific proteins that tag onto things that it remembers chemically, and they do the same thing. It forms a antigen presenting, and then your body now knows to send the thugs in, and then to go kill it. So you could see how if you have AIDS, your T cells go awry. That means you got nobody to tattle. Nobody to tattle. Therefore, infection can just roll in and just do all the damage it wants. Same thing with the argument that that there's an argument now that the kids should go back to school, because if you're exposed to things, then you'll remember it, and then you'll get better. Now that's a good argument, but the problem is, remember the chain of infection. I'm not too worried about children dying. I'm worried about children being part of the chain of infection that will bring it to grandma, because grandma or whoever else is immunocompromised in the house. Okay, and that's the argument currently. So you could see how people cherry pick science for their political needs. We are scientists. We don't cherry pick things. We go by data, and data is telling us that there's a chain of infection, and these are the things that I have to go deal with. So what kind of things could I ask you? Oh, by the way, just a little side note, since you know, it's week 2, it'll be week 5 before you know it. It'll be midterms before you know it. I'll be putting up previous quizzes, so it'll give you guys an idea how I ask quizzes. My midterm exam and the final exam is typically anywhere from 50 to 60 multiple choice problems. And also I'll be putting out a video that I made on how to deal with multiple choice examinations, which also has a little bit of study skill sets. So remember, studying isn't enough. You have to have the strategies on how to study and how to conquer the multiple choice examination. And it makes sense. What's going to be your multiple choice? What's going to be the form of your future exams? They're all what? Multiple choice, SATs, GMAT, MCAT, NCLEX, TEAS. All of it is multiple choice. And if you don't know how to deal with multiple choice examinations, then you're probably going to be like me, fail a big exam, and then spend $1,000 on a course that college should have told you about. And that's where I come in. So again, B cells, T cells, they all have memory, meaning to say is they remember chemically of what they saw before, and they can inform your immune system in a quicker fashion than just macrophages or natural killer cells just rolling around. And antigens, antigens versus antibodies. Now, antibodies are proteins, and they look like this. If you look at it chemically, when they start, they form these little Y things. Now, if you notice that this thing has like a rounded end, and this particular antigen is round. Now, what's an antigen? And remember we talked about that glycoprotein coat? An antigen is typically a glycoprotein molecule that has a specific shape. And if the antibody matches up to that shape, then the antibody is going to stick to it, right? So, and kind of call out like, hey, it's going to be a marker to say to your body, hey, this thing we got to go deal with. So essentially an antigen is a chemical or part of the glycoprotein coat of the pathogen that's going to trigger the trouble, right? So for example, right, let's say this is a virus, and it's, let's call it the circle virus. Well, this antibody has a circular chemistry in it that remembers the circle virus. So when it sees another one like this, it's going to chemically attach onto it just like a lock and key, right? So that is the answer to the question, like, how does it remember? Well, it remembers via the protein shape, right? And all you do is take a whole bunch of chemicals together and kind of like Lego, and it'll form like a 3D, it'll form a 3D shape, and your body will chemically remember it. If you ever want to know why and how, I guess do what I did. Get your master's degree in physical chemistry and you can figure it out. But this is the easier way to do it. Now, how is this also important to us chemically and clinically? Right? Well, we have these things called immunoassays. A classic example is ELISA. Western blot is your typical test for HIV. And also, we even have the same kind of tests for HCG, or human chorionic gonadotropin, for your pregnancy test. So that's how we know that it is 99.9% accurate. So when we, and also, by the way, when we perform a very important test, like a pregnancy test or an HIV test, it's run more than once, just to make sure, okay? So this is how it works. We already know that this is the antigen. This may be on a coat of a pathogen, right? So the antibodies will be in your blood, right? Either we put them in there or they're there naturally. Now, what we do chemically is bind another antibody onto these, a secondary antibody, and then see this little star? Well, it's an enzyme, and remember, enzymes change one thing to another thing. So that could be a color, right? For example, the way we detect HCG in a pregnancy test, right? We know what HCG looks like, human chorionic gonadotropin. It only gets released when you're pregnant, well, in theory, right? We have an antibody that's tailored to it, and then we have a colorizing system. And that's how you know when you know you're pregnant, that little pink line comes in. And my family is very, very familiar with this test. Another thing we can also do, instead of the enzyme here, do you think I could put something like tritium or iodine-131, something that's radioactive? So let's say I'm looking for cancer, and I know what the cancer looks like. I could put these antibodies in your blood, and it's going to roll around your blood. When it finds the cancer, it's going to stick to it. And when it sticks to it, guess what? This thing's going to light up, and then we could put the patient through a gamma counter, and then we could see, where do we see the radiation? And when we see it, or we see a color change, or we see the radiation, then that's how we know we have something. And actually, this is how the PCR and also the antibody test for COVID actually works this way. Okay. Okay, that's that. Now let's look at, I still want to get to the chart that I was talking about. I know it's here somewhere. If not, I'll put my own chart. But hey, you could also look it up as well. So I can have a chart, and it's something like this. Okay. Oh, these are your IgGs. They're your immunoglobulin proteins. That's for another class. Because remember, we talked about antibodies. That's what they look. These are different kinds of antibodies in your body. You have IgM, and I remember IgM is mega. IgG, secretory IgA. IgE is really, really common in allergies. You'll learn that in other classes, in your lab classes. I'm going to try to find a chart. That's not it. Let me try to find. Oh, here it is. I think this is it. Oh, yeah, here it is. Goody, goody. Lucky us. Oh. Sorry. Okay. You know what? How's this? Control chat this, and then I could take this, and I could do this, and then we could look at it. And then we can make it bigger. Dagnabbit. There you go. Okay. We already know erythrocytes, biconcave disc, red blood cell, transport oxygen, carbon dioxide, and other nutrients. Platelets, we already know they deal with clotting. Then you have the agranulocytes, lymphocytes, and monocytes, and the granulocytes, neutrophils, eosinophils, and basophils. Now, what's the main function of a neutrophil? It's nondescript. It's phagocytosis. It engulfs foreign body and pathogens, and it releases all these little granules that have these enzymes to break things down. Eosinophils are big in allergic and parasitic responses. And basophil, if there's massive amounts of histamine, which increase in generalized inflammation, right? So if there's a generalized inflammation response, I'm going to see a lot of basophils, right? And of course, lymphocytes, which is B and T cells. If you don't have a lot of them, especially T cells, and the T cells come in two varieties, the T killer, right, or T cytotoxic, and that is called CD8+, or the T helper cell, which is CD4+. You have a deficiency in your T cells, it screams HIV or HTLV. That's another type. So this is a nice thing. I'll put that as part of your notes, but I know it's there somewhere. I taught this class a million times. There's a chart somewhere in, or maybe I'm just wishful thinking. So let's look at everything that we looked so far before we go over what's due for next week. And again, watch the videos, they're back up. And oh, let's watch this thing real quick too.
What's the difference between passive and active immunity? Well, passive immunity is an example of the body using an army of antibodies against a pathogen that it has never been exposed to before. So an example is a fetus inside her mother's womb receiving antibodies from her mother through the placenta. Another example is a mother transferring her antibodies to the born child through breast milk. Active immunity, on the other hand,
all right, let's stop.
Is when
so try to remember that picture. Think mommy and baby, breast milk or via the placenta. So that's passive immunity. That is short term. It's only enough so that the baby can develop their own immunity. That's why we do not promote mommy taking baby out to the mall to show all her friends the first couple of months of life, especially for the first 6 months of life, because for all intents and purposes, your baby is immunocompromised. And we're always promoting breast milk because, yeah, you could get all these formulas. They're just as good as mommy's breast milk. But the one thing that breast milk, the breast milk that's out on the market, they can't replicate these antibodies. Okay? So think short-term, passive, mommy. It's passive because mommy gave it to you, either in utero as a fetus or via breast milk.
body gets exposed to antigens, whether it be by an immunization or just entry into the body through openings in the skin. And it results when you're exposed to antigens and in your body's own B cells trigger memory cells to remember that antigen for the future. So an example of active immunity is, like we said, an immunization. When you receive a vaccination or an immunization, you are intentionally getting a small dose of an antigen so that if you are ever exposed to that antigen again in the future, your body will have the memory cells to fight it off. The antigen is actually a weakened or dead version of the actual pathogen. So it actually won't.
I have to reiterate that one thing that the speaker said for all the anti-vaxxers in this universe. It is only the glycoprotein coat, and not only that, we attenuate it. We make it so innocuous that it won't give you any problems. Now, just like anything in this universe, anything that I put inside you could cause a poor reaction. But I can tell you, as a father of an autistic child, because as a person who's done in the last 14 years exhaustive research regarding autism, because it is affecting my family in very serious ways. And as a person of science, I can equivocally say that vaccines do not cause autism. Autism is a developmental issue because it happens at the level of genetics, and it happened in utero before baby even got to the world. So, and there is absolutely no data, none, that vaccines have ever caused anything, because anything remotely akin to the autistic spectrum. And if you look at it, and if you know anything about autism, it has nothing to do with any developmental delay or developmental exposure. It has everything to do with the exposure of the glycoprotein coat so that these little things, the antibodies, can remember. And oh, looky here. This is the picture that everyone now knows. They chose that picture because the most common virus or family of viruses for the common cold is Coronaviridae. And Coronaviridae, or the coronavirus, looks like this and has the little crown, little crowns sticking out of it. So think active immunity, immunization, or I actually got the disease, right? I actually got, or actually directly got exposed to the disease. And remember, the CDC and the government's argument, which is in my opinion, my opinion is a solid argument for the schools and continuation of the full online for up until the end of the year, is because it's not that we're going to endanger the children or expose the children, or there's not enough danger to expose the children. There's more than enough data that the children will be a wonderful conduit for others who are immunocompromised. And those of us who have children know, when do we all get sick? When do us parents all get sick? We all get sick September. And it's not only because we were exposed to everything that our kid got exposed to. It's because what happens in September? All the stressors of putting your kid through school and transportation and home care and all of that stuff, that gets magnified, especially now during the quarantine and during this very, very highly charged political debate. So you could see how politics actually has a significant role in healthcare, not only regarding funding, but actually effects on your immune system. All right, so with that being said, I think we covered all our bases. So let's talk about what's due next week. Anyone have any questions on anything that we just went over? Questions,
No,
comments?
you pretty much said everything straightforward, so I am all set.
Finoki. So let's look at what's due next week. What's due next week? First, task 2. Make sure you have a concept map. And everyone who did submit already a concept map, it looked good. So just keep on doing what you're doing, right? But make sure it covers all the topics, and try to link the topics, because some of you like give me 3 different pictures, but then you don't show the links in between the 3. Try to do that a little bit better. So that's one. The next thing is, of course, the discussion. So let's look at the discussion. Remember, in your own words, everyone's doing pretty good thus far. And now let's see, we have Ms. Lopez, Ms. Jordan already putting it out there. Is there any evidence that antimicrobial soap, first of all, identify what that is, because medically I don't know what that means, causes an increase in drug-resistant microbes? Those of you who are in lab maybe got my soapbox. I was stepped up to my soapbox, pun intended, and I was talking about how the the marketing for antimicrobial soaps, like, oh, this soap is better than the X one. No, just wash your freaking hands. Soap is soap. All soaps are what? They're basic. pH what? 9? They'll kill anything, but there's no such thing as, I don't know. Don't get me started, right? So, but again, find out yourself, right? And see, is there really such thing as an antimicrobial soap? And will it, does it cause an increase in drug-resistant microbes? Why is it? What is this? And the big part is, do you have evidence? There's a reason why we hand wash. And this is the reason. And is it any special soap? No. Actually, when I went to dermatology, I had 2 weeks dermatology training when I was in medical school. And my first question was, is that Ogilvy Sister Soap really supposed to be better than your skin? You know what all the dermatologists said to me? The best soap in the world is Dove White because it has little to no chemicals. And that's why dermatologists all around the world support just Dove White because it has, it goes, the classic Dove White has no fragrances, no extra chemicals, and no colorings, no additives. It's just soap. And I'm like, no, isn't there something special for zits? Or they're like, no, wash your face, right? Know your anatomy, physiology. And ever since then, I just go whatever's the cheapest and has no colors. That's the one I get. But find out and do your own research, okay? So that's the discussion. And of course, the lesson. Okay, of course, it's a case. And I click on that. I download the case. And of course, it's HIV and the immune system. And read it through because it talks about the things I was talking about. CD4 cells, which is T helper cell, and T killer, also known as the T cytotoxic, CD8. And CD4 cells, and they all work together with antibodies because all of them work together to remember the thing that attacked you. So go through, part 1, go through these questions so you know a little bit more about HIV. And you know what? Just do part 1. Because I don't want you to go classic hypothesis and all this other stuff. Just do part 1.
So only part 1, just this
Only
question.
part 1, just this, because I want you to know, answer these questions regarding HIV. That's it.
Okay.
I could be cruel and make you go through the experiment, but I think we had more than enough for this week. So I think this is good enough, right? And then read through this thing about HIV and how HIV does stuff. And if you look at it right here, right? HIV is so small, it'll go right through this wall, right through this. And this is the insidious, horrible thing about viruses. Viruses don't need to have their own DNA or RNA. It uses your own DNA, your own blueprint, and they hijack your blueprint. And instead of the cell making what it's supposed to make, it erases the blueprint and says, no, you're going to make more virus. It's going to be really cool. Here, try it out. And you can see here, the glycoprotein coat is a what? It's a key, right? And it's a signal, right? And it's a glycoprotein. Now, the funny thing about HIV, GP120, right? It has a glycoprotein coat of 120 pieces. Guess what? In the last 20 years, it changed to 90. Isn't that scary? That means what we thought what looked like HIV now has a different jacket. So it's scary to think that, oh, dagnabbit, we had all this medication to tack this one kind of jacket. Now it has another kind of jacket. And that's actually the thing that we're thinking about coronavirus, because I can tell you right now, it's also one of the main reasons why we can't solve the common cold, because the common cold is a coronavirus, and that particular coronavirus has 40 variants. So that's why sometimes, when your immune system is really down, did you ever get sick on a Tuesday? You get well by Friday, and then next Wednesday you're sick. That's not super infection. That's not getting infected by the same thing twice. You're not getting a relapse. You got hit by 2 entirely different viruses, but they're of the same family, and your immune system didn't recognize the second one.
So if it didn't recognize the second one, does that mean from the first illness you suffered on the Tuesday prior, is it like...
Yeah, it'll recognize the first one if it comes back again. That's why I said it's not a reinfection. It is a different corona family virus. So let's say week 1, you got hit with Larry corona. Well, his sister Isabel hits you next week. But now the cool thing is, if you have a good immune system, you will now remember Larry virus. My daughter's here now; she's giggling. Larry virus, and what was the other virus?
You said Isabella, second one.
Isabella's virus. My
Yeah.
daughter's virus, right? So, because she's infecting. Ha! These are all jokes, people. Thank you. I'm here every day. All right.
I'm sure she's wonderful. Don't start talking about her like that. No,
Yeah, yes, I know. But I guess I got a bag on her every once in a while. You know, you gotta. Those of you who have children, you gotta punch them down a little bit, not physically, of course. You know, you gotta. You know, you can't, because this is my little side note, and I'll let you guys go. We're praising our kids way too much, man. I remember when I was a kid, just being called stupid every day just kept me in check, right? It made me want to get smarter, right?
Yeah.
But telling your kid that, oh, you're a genius every day, because some of these kids aren't. And, you know, being in education, it's kind of scary. But again, positivity, right? Try to everyone keep positive, because there's a reason why you guys made it this far. Okay,
Right.
so do
Professor,
what you need to do.
I have a question. For the concept map, I know they're in task 1. I think I believe there was like a little link to use.
On how to do a concept map. Yeah, I don't like that one too much.
Me too.
I look up the one in Google, the one that comes up.
Yeah, because I'm new to
those are
that, so
better.
I'm like, I don't know if I should do that or I should
do it.
look it up.
Yeah, look it up, and then also, like I said, let's say, for example, you're not like too like right now you're not too savvy and you haven't set up a tutoring session with me yet, right?
Yeah, no, I
Take a
haven't.
blank piece of paper, get a ruler and a pen, and I don't know, like a piece of a cup or a coin, and then you could make circles and arrows, and then you do it that way, and then take a picture of it with your phone and then send it.
Okay.
That's what I do.
How can I sign up?
Yeah. Just you can sign up for tutoring. Just shoot me a call or shoot me an email. And hey, Dr. Garais, are you available in this and this time? Give me a time, and then I'll tell you if I'm available, and then we could do a quick Zoom session.
Okay, yeah, that way I can learn how to do this concept.
Or we could do that now.
Well,
we could do that now.
Okay.
Yeah, the concept, if you even Google concept map template, that's what I did last semester, it'll give you like a basic idea of what you're looking for in a concept map, and it really depends on the assignment, basically, on how everything is put together. Every concept map is different, so it definitely would be a good idea to talk to Dr. Garais and go to Google and just kind of do some
Yeah, I'll give you a quick thing on concept map. Let's say I'm you.
Okay.
I have Microsoft Word, right?
Yeah.
And I want to talk about, one of the topics was white blood cells, right? So I go into Word like I am here, and
So I can choose any topic, right?
yeah, any topic, and then insert shapes. Okay, I'm gonna pick a circle, and I'm gonna put it like in the middle of the page somewhere, and in that circle I'm gonna say white blood cells. Okay. And then from there, we know we have 2 categories of white blood cells, yes?
Yeah.
So then I'm going to do what? Insert shapes. I'm going to do an arrow, and one arrow is going to go this way, right? And then another insert, and another shape, and another arrow goes this way. And then can I have then other circles?
like a tree branching out.
Yeah, like a tree branch out. And another circle, I can move this here. And then I could probably copy it. And I'll probably paste it. And then I can move this circle over here. And then I could write in this circle, granulocytes. Right? Agranulocytes.
Okay.
And then you have other arrows. You see how I'm building it?
Okay.
Now,
I see.
what is
Kind
the-
of-
what-
it's like notes, but stacking up. Like
Yeah,
in
but
a-
you could see the advantage of it versus notes. It's way more visual.
yeah. I like
If
that.
you just read letters, you're not going to remember it.
I like to just draw mine because it just makes it easier that way. Like Word is helpful, but I personally
Yeah,
just
you
like
could see how it, like, you got to be a little bit savvy, and you got to take notes and stuff. And I'm a pencil paper guy, so
same.
When my professor wants a concept map, I kind of draw it out first in paper, and then I do it pretty on Microsoft Word or wherever. You could do it that way. But again, all these little skill sets are helping you, and it also forces you to go back to the lecture and it forces you to, what did he say? Because right now everyone's feeling all good, right? Yay, we have an hour of instruction and I'm totally remembering it. But what happens when, you know, you trip over a rock and then tomorrow morning you look at my notes and went, I have no idea what he said. And then you feel bad, don't you? You shouldn't feel bad, because only 14% of the population are auditory learners. That's why we're forcing you to do this, because guess what? 40% plus population are visual learners. That's why you could see me when I teach. I love pictures. I love maps. I love things that, you know, that are more visual, because I don't like words. And even though I went to medical school, I really don't like reading. I only read when I want to sleep, right? So, but I'm a professor. I have to read hundreds of pages, thousands of pages sometimes. But then you could also set up tutoring with me. I can teach you how to scan. Do you guys ever wonder how lawyers, engineers, and doctors can read a 5,000-page book in a day?
Yes.
We don't read every single word.
Yeah.
That's insane.
Skimming. It's better to skim.
Well, I can tell you right now, the top 10% of my class will read every single word because they're insane. And also, a lot of doctors have something called an eidetic memory. It's not only photographic, they can access it. And it's creepy. It is so creepy. You're like my friend Grace, she's the valedictorian of my class. Oh, by the way, she's Chinese American. She grew up here, right? Then she goes, you know what? I learned Spanish in a year. I'm going to learn Chinese in a year. Guess what she did? While she was in medical school, she learned Mandarin. And now she's learning, freaking in a year. She started talking to patients and family members. And I was like, Grace, what the fudge? And she was like, yeah, isn't it cool? Because language is great. And I'm looking at her like, you know what? I lived in New York I lived in Upper Manhattan for 12 years. And my Spanish still is horrible.
Oh my God. She cheated. No, I'm just kidding.
And then she's like, and she'll do stuff like, oh, this chart, oh, that's on page 239, volume 2 of your Hannon textbook. And it goes, but it was in purple. It wasn't in green.
She has a photographic memory.
It's not only photographic, but they can access it.
It's like accessing a file.
Yeah, they can access a file, and it's creepy because it's one thing photographic, like, oh, I remember that. But
I have my old boss at my veterinary job I just left. She had a photographic memory. She could say, oh, well, you know, if you look in the manual, the work manual, it's on this page at this. I'm like, how do you remember that?
Yeah, how do you remember a Merck manual? Crazy person. By the way, you know how doctors are so arrogant that we're the smartest. It's really hard to get into medical school. No, you know what's harder to get into medical school? Veterinary school. There are like 1,100 medical schools in this country, but there are only like 40 vet schools. My fraternity brother Lewis got into 8 medical schools. I mean, first round, right? Oh, he got waitlisted for vet school twice.
Wow.
He finally got in, but he was like, should I just go to medical school? I'm like, and I barely got in. I'm like, Lewis, can I punch you in the face? Like, really hard. He goes, I don't like you. He goes, I really don't like you, Lewis. And Lewis, he was smart, but he wasn't, but after he became a vet and his study skill sets, he can teach this A&P class. Because just imagine a vet, you got to know the anatomy and physiology of every animal.
Right.
That's crazy. Right. And also vets make crazy money. He does some sort of poodle factory in Upper West Side Manhattan, and he's making large 6 figures.
What's a poodle factory?
Oh, I didn't tell you what a poodle factory is. Do you know that these people breed poodles and breed these dogs for competition? And it's a multi-million-dollar industry. My friend Lewis is one of these dog whisperers who, I could breed you this poodle. I could do this. They could do all these fabulous things with animals. And he also has, he married like a dog psychiatrist.
What?
Yeah, they make crazy money, man.
Gosh.
I'm like, oh, I should just did that.
That's it. I quit. I'm moving on.
I quit. Because I'm getting into this. I don't know. I just call it the poodle factory because he just generates poodles for rich people.
But he does it in a humane way. I'm assuming.
I assume because he loves animals and stuff.
Well, I'm a strong advocate for like adopt, don't shop, you know, and
Yeah, he's my fraternity brother. There was a rat in the frat house. All of us were chasing it to kill it. Lewis was the only smart one to trap it. And then we were all like, Lewis, give me the rat. We're going to kill it. It's disgusting. It breeds disease. Lewis raised it, and eventually it became our pet.
Wow. Well, isn't it the flea that spreads the disease, not the rat? The rat's just
I have no idea. I don't want, man, I grew up in the Bronx. I do not want rats sleeping in the same room as I am. I grew up with it. Don't need it. Don't need it when I'm in my 20s. But
I watched
all
a
funny
little
stories aside,
informational-
you could see what I'm saying. Like my brothers, especially somebody like Lewis, they didn't take no for a reason. Imagine waiting 2 years, for 2 years, working at some crappy job just so you can get into vet school.
Hey, I feel that, you know, I went to that
2
crappy
years.
college before this, and I kept getting rejected, so I kept pushing, and now I'm
And you
here.
keep on going. You just keep on going.
You have
So
to, because
if
if
this
you don't,
program,
if
this program doesn't like you, find somebody else.
well, I mean, if you don't keep pushing to do what your goal is, there's like, you're just going to end up disappointed in yourself and depressed. And
Well,
I
you're
don't want
gonna
to
end up like 99.9% of. I always talk about people on the stoop. When I go to my old neighborhood in the Bronx or Jersey City, there's always one cat on the stoop going, man, I could have been in the NBA, man. Oh, I could have been in Special Forces, man. And you're like, no, you couldn't, because if you could, you would.
Well, that's all self-sabotage.
Coulda, woulda, shouldas, right?
Yeah. Yeah, that's all self-sabotage. It kind of.
I flunked out of Indoc twice. You don't see me saying, "Oh, could have been a recon Marine." No, I couldn't. I flunked out. I'll be the first one to admit it. But then you do what? You find different venues, and thank goodness, because if I didn't flunk out of those schools, and I left the military, I wouldn't be where I am. Things happen for a reason, always.
Yep. I strongly.
Everybody, this is everybody. Miss Eddie, Miss Lopez, Miss Witchin. If that's all three, I could have sworn there was one more of you, but I'll probably get a call on how.
I think it was Jordan, wasn't it?
Who was it?
Jordan. I think I saw her.
Was it Janella? All right. Sometimes
Janelle, I think her name.
Yep. All right. So with that said, ladies, have a good night. And Miss Lopez, shoot me an email on my availability. So if you still want to talk more about how to do stuff.
Yeah. I was gonna actually contact you recently for the, like how to do citations, because sometimes I try to look for citations on sites and it's hard to find them. But either way, I will.
No, you just have the program generate it. I'll email you my APA format video that I made.
Yeah, it's called BibMe. He'll send you the video that he made.
It makes life easy.
Like really explaining everything, and made it easier. So he'll give you all the information.
Okay, perfect. Thank you so much, Professor.
All right, ladies, have a good one. And Ms. Lopez, expect a email from me within the hour.
Okay, all right, thank you, sir, and everybody have a good night. Thank you.
Bye-bye.
Bye.